Let's talk about marketplace issues, Obamacare issues, ACA complaints, all of that. It's all the same thing. My name is Jo Hutchison. I am a broker with Founders Life and Health here in beautiful St. Louis, Missouri. And today we're going to be talking about the biggest complaints that people have with Obamacare. First things first, let's talk about what it is. Obamacare, Marketplace, ACA, Affordable Care Act. It is all the same thing. So people have given me a hard time about using the word Obamacare every once in a while. I say that because a lot of people only know it as Obamacare, and I want to make sure that we're talking to everybody that needs to get the information. So it is all the same thing. Marketplace, ACA stands for Affordable Care Act, and Obamacare. We are talking literally about all the same things when we use those words. Secondly, if you are watching this video because you're writing a term paper, this is not the video for you. This video is going to give real information to people that are trying to enroll in healthcare. It is not to help you with your college term paper. And lastly, I'm not going to get political here. I don't get political in any of these videos. I'm just giving you the facts about how marketplace coverage works, how you can make it work for you, and the things that you need to avoid when you're trying to enroll in a plan. Okay, here's the very first and probably by far the biggest complaint that I hear about marketplace coverage is that it doesn't cover anything. Well, yes and no. So likely if you have enrolled in a plan and you've never had them pay for anything, my guess is that you enrolled in a plan that had you pay the entire deductible up front. When you go to enroll in your marketplace coverage, you need to make sure that you are enrolling in a plan that has coverage before you hit the deductible. So as you're scrolling through all the plans, and I know there's a million of them, likely you will see the very first plan you see is going to be a real low a real low premium. And people get excited about that. Of course, they want to pay the lowest that they possibly can. So just for this example, let's use nice round numbers. Let's say that this plan is $100 per month. Well, when you look over to the right-hand side of that plan, it will list out your doctor's copays, specialist copays, prescription costs, and it will say next to it, $20 after deductible, 50% after deductible, 40% after deductible. Those are the plans that you want to stay away from unless your deductible is $0 on that plan. When you look at the plan and that deductible is $9,000, that means you are going to have to pay everything until you hit the $9,000 deductible mark, and then some benefits will start kicking in. Personally, I stay away from those plans. If you keep scrolling, same carrier for that plan that was $100 a month will maybe be $120 a month, and right next to that it will say doctor's copay $20, specialist copay $50. That means you are going to get benefits before you actually pay the deductible. So biggest complaint I hear, that is the biggest complaint. Well, they never paid for anything. Most likely that means you enrolled in a plan that had you paying the entire deductible up front. We want to stay away from those plans. That's how we solve that one. Okay, biggest complaint number 2, and this one is legit. It's the networks, doctors, networks. It is so tough. So I always prep my clients when we talk for the first time as I'm going through and getting your information, finding out what doctors we want to keep in network. If you have a lot of doctors, we are most likely not going to be able to get all of those doctors in network. So there's ways to kind of finagle that a little bit. If you have priority doctors, like these are the 2 or 3 doctors that I absolutely must have, you need to, when you're enrolling, if you're enrolling yourself, make sure you're paying attention to putting those doctors into the plan information so that when it pops up, you can see that they're in network. If you're working with a broker like myself, make sure that your broker knows these are the doctors that I absolutely must have. One trick, kind of, to try to get through some of that is if you have a doctor that you really only see once a year for something, what you may want to do is consider just paying out of pocket for that doctor. So if it's somebody that you see for ongoing care, somebody that you have to see every month or a couple times a month or whatever, you've got something going on that you need to see that doctor. We absolutely need to make sure that that doctor stays in network. But if it's somebody that you only see once a year, let's call them, let's find out what their out-of-pocket pay cost is. Basically, you're going to be paying them without using insurance. It's going to be worth it for you if you want to continue to see that doctor to just pay them directly and not use the insurance to continue to be able to see that doctor. Every year during open enrollment, which is about to start happening for Marketplace now, the networks all change. Everybody moves around a little bit. Sometimes we get some issues with doctors that were in one plan are no longer in that plan. We need to pay attention to that during open enrollment. But my point is, as you get to open enrollment for the next year, if you have a shift in doctors, or if you decide that there is a doctor that you absolutely must have in network, that's why we have open enrollment. You can enroll in a new plan starting the following year to make sure that that doctor is in network. So we'll just pay attention to that during open enrollment for the following year. Issue number 3 is affordability. I often hear the complaint that even though it's called the Affordable Care Act, it is not actually affordable. And there's things that we need to pay attention to make sure that we are getting the right numbers. And there are other options that we can look at if the plans that are coming back are not affordable for you. When you go to enroll in your Marketplace plan, most likely we are going to be applying for a subsidy as well to make sure that we can get some help offsetting the cost of what the plan will be. When you go to do that, one helpful hint is that what we're going to be doing is, first of all, we're looking at your household income. And even if only you are applying, we need to put the household income in, but we also need to put all of your household members in so that they know that it's not just you in the household that have expenses as well. So that's the first thing. The second thing is we want to make sure that we're using your adjusted gross income, not your gross income. So when you go to file your taxes, typically your adjusted gross income, if you're filing a regular 1040, is going to be line 11. That's the number that we are either going to be using if your income has stayed the same, or we're going to be kind of projecting for next year if your income has changed. You've lost a job, you've retired, something has changed with your work history, that your income is going to change. Sometimes that's tough. We have to kind of estimate what the income is going to be for this year. So knowing that it's the adjusted gross income, that is different than your gross income. So we're going to make sure that we're paying attention to deductions and including that when we're figuring out what your income is going to be. The second part of that is, as you are looking at your income, if your income is below a certain level, sometimes Marketplace just isn't the right fit for you, and that's why every state has state-based care set up. But under a certain income level, you will be able to apply for Medicaid, which means that you will get free or reduced cost coverage that will be way less expensive than what the Marketplace plan was working out to. That being said, if you apply for Medicaid and you are denied, you can take that denial letter and go back to the Marketplace and get reduced coverage there. So keep that in mind. Thirdly, on the other end of the spectrum, if you make too much money for Marketplace and you are not eligible for a subsidy, there are other options out there. There are several private PPO plans that have popped up in the last couple of years that are set up specifically for self-employed individuals. Those premiums are often less, way less than what Marketplace coverage would be without a subsidy. They are typically PPOs, they typically have low deductibles, so you can look into those options as well. Issue number 4 with Marketplace coverage, and the biggest complaints that I hear are about prescriptions. And I'm the first one to tell you, prescriptions are tough. If you have specialty meds or tier 4, tier 5 meds, it is harder to find plans that will cover those prescriptions. If you're coming off of group coverage where your insurance carrier was much more lenient about covering brand name prescriptions, but there are generic versions available, you will want to do some research and figure out with your doctor if it is right for you to switch to some of those generics. On Marketplace coverage, the generics are going to be much easier to get covered. For some of us, however, that's just not an option. Personally, my son has Crohn's disease and he takes Humira, which is a specialty med. It's a tier 5 specialty med. I think if we had to pay out of pocket for it, it's like $8,000 a month or something ridiculous like that. But on those specialty meds that there just isn't a generic for, there are other ways to go around finding copay assistance. So the first place to start with that is with the drug manufacturer themselves. You go to the drug manufacturer's website, there is going to be a button on their website that says get copay assistant or financial assistance here. you will want to click that and work through, give them all of your information. They will give you a discount card. They will send you in the right direction to get copay assistance for those medications. In addition to that, talk to your pharmacist. If you have a specialty medication, it could be that you're not getting your prescription from Walgreens or CVS or Publix or whatever up the road. It could be that you have like an online pharmacy or somebody that, calls you once a month to get the refill. Talk to them. They have copay assistance programs too. Sometimes their copay assistance and the actual drug manufacturer's copay assistance works hand in hand to give you additional discounts. If you are getting your medication from a Walgreens or a CVS or something like that, talk to that pharmacist also. The pharmacists are informed on discount programs, so talk to them about different ways to get discounts on helping to pay for some of those drugs. Those are the big complaints that I hear. I'm sure there are more, and please feel free to send me your complaints. I love to hear them, just so that we can try to figure out how to fix them and how to do better. You can always feel free to reach out to me. You can call me, you can email me, you can connect with me through our website and schedule a time to talk to me through our Calendly app. We are licensed in most states, and our services are free of charge to our customers. So I hope this was helpful. Thank you so much for watching.